Greetings, everyone. My name is Kim Kreider. I am a health educator for WellSpan. I work out of Chambersburg in Franklin County, but due to the ability to have virtual classes, one of the positive things that came out of COVID, we are able to connect with people from all across the WellSpan footprint and beyond. So welcome to today's breathing technique workshop. In addition to being a health educator, I am also a registered certified yoga teacher and love teaching meditation, breathing technique workshops, and of course, yoga. So I welcome you to this workshop, and we are going to dive right in. If my technology will, oh, tell me I'm not stuck. There it goes. Let me move some things around here because I know my toolbar gets in the way of the slides. So before we get started into actual techniques, I want to make sure that we're all kind of operating from the same definitions and understanding of breathing. Something we rarely think about unless maybe we have a cold or we have a breathing condition like asthma or COPD or something that causes us to think about the way we breathe. Typically, we breathe automatically, roughly 25,000 times a day. We have the luxury of not having to think about it. Some of us breathe through our nose, some of us breathe through our mouth. Some of us, it's a combination depending on what we're doing. And one of the things that we'll talk a lot about is the importance of breathing through your nose. And today we're going to be focused on intentional breathing. So we are going to intentionally and actively control our breath, how long we inhale, how long we hold, how long we exhale. And we'll learn 4 different breathing techniques today during this workshop that you can put into practice across any parts of your day, work day, or home life. And so having just shared my screen, I'm going to unshare or stop sharing, and I'm going to pull up a video. So give me just a moment. Again, I want to make sure that we have an understanding of the mechanics of breathing. And let me pull that up on this side. There it is. All right, here we go.
Mechanics of breathing. Consciously take a breath and think about the fact that there are 10 different muscle groups working together to make this happen. These muscle groups include the diaphragm and intercostal muscles. The main muscle used for breathing is the diaphragm. The diaphragm is a dome-shaped structure consisting of several large muscles, which is sandwiched between the chest cavity, containing the lungs and the rib cage, and the abdomen, containing the digestive system, including your stomach. The muscles that move the rib cage itself are the internal and external intercostal muscles. They are each attached to the ribs and run between them. To inhale air, the diaphragm contracts and moves down, while the external intercostal muscles contract, forcing the rib cage up and out. The combined effect of the diaphragm and intercostal muscles increases the volume of the chest cavity and expands the lungs. This expansion of the lungs increases their volume, reducing the pressure within them, causing air to be drawn in. This action is similar to a piston sucking petrol into a car engine. In normal breathing, we use around 25% of our lung capacity, which is called our tidal volume. As you inhale deeply, the diaphragm moves further down into the abdomen, pushing your belly out, giving more room for the lungs to expand and draw in more air. This type of breathing is called belly breathing or abdominal breathing and is critical to prepare you for your free dive. Belly breathing allows you to completely fill your lungs with air. The maximum amount of air your lungs can hold is called your total lung capacity. With training, you can use more of your lung capacity.
All right, so let me stop that share and reshare my PowerPoint slides. All right, so we have a general idea from that short video of the mechanics of our breathing. Most of us are very shallow breathers, and it mentioned in the video that we use about 25% of our lung capacity. So today we're going to practice on practice deep breathing. So where we're expanding the lungs and the rib cage and the belly. And also we're going to focus on less breaths per minute because we're going to slow down how long we inhale and how long we exhale. Typically, 5 to 6 breaths per minute is what's optimal. Most of us breathe quite a bit more than that. So when we are looking at breathing through the nose, the importance of breathing through the nose is that when we breathe through the mouth, we lose a lot of the nose mechanics. And so that includes all the little hairs that are inside the nose. And when we breathe in through the nose, it does a better job at clearing the air or cleaning the air, heating the air when we breathe in through the nose, moistening the air when we breathe in through the nose. And we take in about 20% more oxygen when we breathe in through the nose. And all of that to say, it makes the oxygen getting into our cells easier to absorb when we breathe in through the nose. Breathing in through the nose also triggers a variety of hormones and chemicals, and that may help lower blood pressure or ease digestion, and also may help regulate the heart rate breathing through the nose. It's interesting to, as I've gotten more in tune with my own breathing, how often I find myself breathing through my mouth, particularly when I exercise. And I've had to train myself with varying degrees of success to close my mouth and breathe through my nose, but it definitely helps my stamina and endurance when I'm exercising. And also when we are, let me go back to that one slide again. When we're talking about inhales and exhales, each side of the nostril and the inhales and the exhales themselves activate a different response. So when you're inhaling and breathing in through just the right nostril, which, you would have to be holding the left closed to do that, you would be activating the sympathetic nervous system, which is the fight or flight. And okay, yeah, sorry, somebody couldn't hear, but it looks like they're getting that settled out. So inhaling activates fight or flight. Exhaling is parasympathetic or rest and relax, and that's the left nostril. So it's interesting how even the inhale and the exhale will activate different parts of the nervous system, as well as which side of the nose you're breathing in and out of. And so as we begin to prepare for practice, some things to keep in mind. I know it's lunch hour. I know some of you are at work. As best you're able, try to find, maybe you have your headphones on or your headphones. And I was going to say earbuds. If you can find a quiet spot, if you're at home, whatever works, and it may not be optimal, and that's okay. Find what is going to be best for you today. As we go through the breathing techniques, the email that came with the Zoom link contained a couple of handouts, one of which listed out all the steps we're going to go through today for each breathing technique. I wanted to make sure that during the workshop, you were able to just focus on practicing and not having to write anything down. It's all written down for you. You can print that out. Of course, if you've printed it out already and you want to take notes, feel free to do that, but I didn't want you to have to worry about writing down each little step. As we're going through the breathing techniques, if you find yourself getting dizzy or getting a headache, feeling anxious, just stop whatever breathing technique we're working on and come back to your regular breath practice. Breathing practices affect different people in different ways, as do many things. So be mindful of that, honor your own body, and just stop if it doesn't feel right. You can always hop back in as if we, I'll go through several rounds of each breath practice. So you could always hop back in if you want to try it again. As we're practicing and just in general, you want each breath to have 4 qualities. It's quiet, smooth, even, and continuous. Now, that's not going to be perfect, but it's something to pay attention to as often as you can. And as we begin to practice kind of relaxed breathing, intentional breathing, again, you see on the slide, deep paced breathing. The overall purpose is to slow our breath, to take less breaths per minute, take in more oxygen, and make our breathing more efficient. And in the process, hopefully, depending on the breath practice, maybe lower some stress, lower some anxiety, maybe increase clarity or focus. And I talked about the quiet setting, comfortable position. Most of us tend to, especially if we're sitting at a desk all day, but even in general, most of us tend to slouch. Even if it's a little bit. When you start to practice, you've got some options depending on your situation where you happen to be right now. If you're seated, I want you to sit up tall, not rigid, but just tall, because that's going to allow you to access a full belly and expand the lungs and the chest. If you have the ability to, because you won't need to see me necessarily, if you have the ability to lay down on the floor on your back, either with legs out long or knees bent, or maybe you're laying on a couch or a bed if you're at home. Sometimes lying on our back makes figuring some of the breathing practices, makes them figuring out a little bit easier. It's a little easier to feel the movement lying down than seated sometimes, and for some people. As we're practicing, I encourage you to let thoughts come and go, let interruptions or distractions come and go, and without judgment. Whether that distraction is just, you feel silly, or the breathing practice feels weird, or again, there's an outside interruption or distraction. Keep an open attitude, try to let things come and go as we move through the practice. I'm going to check for questions again. I don't see any. All right, so the first thing we're going to do is just observe our own breath. So I'll invite you to close your eyes, or if that's uncomfortable for you, you can take a soft gaze, just kind of looking down the nose at the knees or the floor, depending on how you're situated. And I want you to just notice the breath. Don't change anything. Just notice how you normally breathe. And you may pay attention to things like, is the breathing shallow or deep? Is the inhale longer than the exhale? Or maybe it's the reverse. Is your breathing labored, or is it easy, at ease? Is the inhale, exhale, are they long or short? Notice what you notice. Release and relax your attention from your breath. And you can keep the eyes closed or the gaze soft, or if you want to open the eyes wide, you can. We're going to shift gears into our first breathing technique practice. Again, stop if anything doesn't feel right. Try to have a nice, long, tall spine. If you're lying down or seated, maybe you're standing, that's fine too. And again, everything's written down for you. You can just focus on practicing. And I use the word practice deliberately. Some of these, all of them will take practice for varying reasons. So the first thing we're going to practice is a 3-part breath, or you might hear it called yogic breathing. It's a very standard breathing practice in yoga. And when practiced regularly, may help increase oxygen supply, increase our lung capacity, and also induce a sense of calmness and peace. So we're going to do this in phases. So again, we're sitting upright in a chair or on the floor. Again, maybe we're standing. And I want you to place one hand or the other, or both hands, whatever's comfortable for you, on the belly, right around the navel. And then I want you to inhale. And as you inhale, I want you to deliberately blow that belly up like a balloon. So inhale deep into the belly and then just exhale. So you'll inhale, blowing the belly up, expanding that belly. And then on the exhale, breathing out, you'll feel that belly deflate. The belly button may pull back toward the spine slightly. We'll do a couple more like that. Just inhaling, breathing that air into the belly, deep into the belly. Belly blows up like a balloon. And then exhaling. Maybe you deliberately pull the belly button back toward the spine very gently. Last one, inhaling deep into the belly, hands are over the belly so you feel the hands rise, and then exhaling, you feel those hands lower or pull back. And then release and relax your attention from hands on the belly. And I want you to move one or both hands just up a few inches, roughly around the bottom of the rib cage. And then we're going to do the same thing. I want you to take a nice big inhale, and I want you to inhale and feel the ribs expand. This takes a little bit of practice. Take your time. Inhaling, feel the ribs expand, and maybe the belly does too. Don't worry about that. And on the exhale, same thing, let it out, and the hands will lower or pull back. So nice big inhale, ribs expand, hands rise, and then that exhale and the ribs collapse. It's probably not the right word. And the hands lower. Inhaling, expand the ribs. Exhale, let the ribs fall. Inhale, expand the ribs. Exhale, let the ribs fall. Last one, inhale, expand the ribs. And exhale, let the ribs fall. And then release and relax, come back to your normal breath rhythm. After each breathing technique, I'm going to stop sharing my screen and take questions, and that's also going to give us a little time to adjust between breathing techniques. So we're moving on to the third part of this, and that's to move the hands one last time to just below the collarbone. You could have one hand or both hands, doesn't matter, whatever's comfortable for you. And this time let's inhale, and as we inhale, we're going to really expand the lungs and feel the upper chest expand. So we inhale and exhale. Again, really focusing on the chest. Inhaling deeply, feeling the chest rise. Exhaling slowly, feeling the chest lower, feeling the hands lower. Inhaling, chest rises. Exhale, release. Inhale, chest rises. Exhale, chest releases. Last one. Inhale, allow the chest to rise. Exhale, release. Now, come back to your normal breath rhythm. Drop the hands for a moment. And we're going to put all of those things together. So here's where we're doing the 3-part breath, which is phase 2 of this breathing practice. You'll place one hand or the other on the belly button or thereabouts. And then you're going to bring the other hand to just below, somewhere on the upper chest, just below the collarbone. And we're going to connect all of those motions into one breath. And I'll walk you through that. I'm going to talk you, we're going to go through it once. Don't practice yet. Just, I'm going to talk you through it, and then we'll start. So as we inhale the first time, the belly rises, then we bring it into the ribs, then we bring it into the chest. And on the exhale, we let the chest lower, the ribs release, the belly deflates. All right, so that's what it's going to look like. So we're going to take a regular breath here. Nice inhale, nice exhale, and here we go. Nice big inhale into the belly. Bring it into the ribs. Chest rises, and then exhale, the chest lowers, the ribs release, the belly lowers. Inhale, bring it into the belly, belly rises, ribs expand, bring it into the chest, rises. Exhale, chest lowers, ribs release, belly releases. Inhale, raise the belly, expand the ribs, expand the chest. Exhale, release the chest, release the ribs, release the belly. We'll do one more. Inhale, blow that belly up like a balloon. Then into the ribs, they expand. Then bring it into the chest rises. And then exhale, release, chest releases, ribs release, belly releases. Now release, relax, come back to your normal breath rhythm. I am going to stop share for just a moment so I can see everybody. Feel free to put any questions in the chat or unmute and ask a question, or even just give feedback. What did that feel like? Was it difficult? Have you done that before? Oh, yes. Both the inhales and the exhales were through the nose on this particular breath practice. Great question. I gotta, it helped someone to relax. Someone said it felt kind of scary to them. The long, deep breaths almost made me feel dizzy. Those are not uncommon results when we start to intentionally change our breath practice. So find your own tempo or cadence or pace, whatever word you want to use. You know, we're going to get to some practices here in a second where I'm counting. And if you slow the counting down or speed the counting up, it's going to affect how long you're holding something. And so when I was going through that, expand the belly, expand the ribs, expand the lungs, because I have to speak it, it slows it down. So when you start to practice on your own, you might go a little bit faster and it's a little bit easier to do. And I would encourage you, if you're sitting, when you get home, if you're sitting because you're at work, when you get home, try it lying on your back. That often changes the ability to feel how all this pulls together. Would there be any modifications for this for our COPD patients? It would really depend on the patient. My guess is for COPD, you might stick to just the belly part of the breath or go more quickly through the sequence, belly right to ribs, right to chest, and then let it go. But it really would be individually dependent. And with COPD, breathing through the nose, if that's an issue and it has to be done through the mouth, I'm giving you all sort of perfect world scenarios, but we don't live in that perfect world. At least I don't. So sometimes you have to modify based on what's available to you. Yeah, having trouble feeling and getting the belly to rise. Again, not uncommon. We are typically very shallow breathers. So we rarely breathe into the belly. So having said that, we practice 3-part breathing. I would just focus on belly breathing and come back to the 3-part breath once you have belly breathing, just that part kind of you've practiced that, so it's become more natural. Again, try lying on your back the next time you practice belly breathing, and you might find it's a little bit easier to intentionally fill that belly like a balloon. All right, I'm going to just be mindful of our time. We have 3 more techniques to get through, so I'm going to start sharing my screen again. And if you have more questions or feedback or things like that, I can always stay on afterward, or you can always just reach out to me individually. All right, so let me get back to the screen. So we're going to move on to the next practice. All right, so this next practice is called box breath. And that'll make more sense here in a moment. There's lots of names for this, but it's most commonly known as box breath. It is used by Navy SEALs currently to help them get calm and stay calm and focused when they're in tense situations. So really great for that, but also in general, just to increase mental clarity, energy, focus. It may reduce physical symptoms of stress in the body, improve future reactions to stress, and then can also have a positive effect on emotions and well-being. So we're going to practice box breath, and it's literally, the reason it's called box breath is it's inhale 4, hold 4, exhale 4, hold 4, and you continue in that sequence. And I'm going to be counting this. I'm going to count at a very moderate pace, but recognize as you begin to practice on your own, you might have a quicker count to make it a little bit easier as you practice being able to expand those inhales and exhales. So keep that in mind. If my pace seems challenging for you, when you start to practice on your own, you can count quicker than what I'm doing. So let's take just a regular breath, a nice inhale, a nice exhale, and then I'm going to begin and you jump in whenever feels right for you. Inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4, inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4, inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4, inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, hold, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. Release, relax, come back to your normal breath rhythm. At the beginning of the workshop, I mentioned, breathing 5 to 6 times in a minute is really optimal, nice deep breathing. We just did that with this box breath. Before I stop sharing my screen and take questions, I wanted to point out that longer exhales, as I said, again, at the beginning of the workshop, exhale, activates that parasympathetic, that rest and relax response in the nervous system. So a longer exhale will activate that rest or relax. So a variation on the box breath that we just did is, and to relax the body more deeply, is to change up the numbering a little bit. So it would be inhaling on a count of 4, and holding on a count of 2, but exhaling on a count of 6. So it's a little bit of a variation that you can try. Again, all of this is written down. I'm going to stop sharing. So way different breath practice or breath technique than the first one. But maybe just as challenging or hard to get a handle on. I don't know. So anybody have any questions, any feedback on how that made them feel? Again, you can put it in the chat or unmute, whatever you're comfortable with. Not seeing anybody unmuting. Let me switch pages here for a minute. Yeah, Tina, it is much easier than the 3-part breath. You had to focus a little less on activating the breath and muscle groups at the same time. You just really had to follow my counting. Yeah, somebody else is commenting that it's easier. Awesome. Yeah, I tried it laying down and it was much better. Lying on your back is a great place to start with breath practice because it allows you to get a little bit better handle on the muscles that we saw in that mechanics of breathing video. All right. Let me share my screen again. All right. So we did box breath with a count. We're getting ready to do another very popular breath called 4-7-8 breath. Again, it's a count. The difference being the length of the inhale, exhale, and hold. So this is a very deep rhythmic breathing, helps promote deep relaxation and sleep. Great breath to do several rounds of before you go to bed. I love 4-7-8 breath. And you got 2 handouts in your email for this class. The other one was an additional resource, breathing resource handout, and in it has Dr. Wheel doing a YouTube video of him doing 4-7-8 breath that has a little bit of a variation from maybe what I'm teaching today. So when we're doing 4-7-8 breath, again, keep in mind that my pace of counting, you can always make that a little quicker when you start to practice on your own to help get you through all the way through the 4 and the 7 and the 8. So in this particular breath, we're going to be breathing in for 4. So inhaling for 4, we're going to be holding for 7, and then we're going to exhale on the 8. And when you exhale on the 8, and I realize some of you may be at work and this may not work, if you have a lot of coworkers around. But I want you to imagine that you're blowing out a birthday candle on the exhale. So this time we're exhaling out of the mouth, and it's going to be a if again, you're in a place where that isn't a great thing to do, just breathe out through the mouth quietly. But that's the difference between what we just did with box breath and these 4, 7, 8 breaths. So we're going to go ahead and take a regular breath. Inhaling and exhaling. And again, I'll count us through. You join in whenever it makes sense for you. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, whoosh, 3, 4, 5, 6, 7, 8. Big deep inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, whoosh, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, whoosh, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7, 8. Exhale, whoosh, 3, 4, 5, 6, 7, 8. Inhale, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, whoosh, 3, 4, 5, 6, 7, 8. Release, relax, come back to your normal breath. I'm going to stop share. Another breathing technique, very different. You'll find as you practice, when you take that inhale, that really expanding into the belly allows you to pull in enough air so you have a lot of air to exhale out after that long 7 count hold. Again, you can adjust how quickly you count as you start to practice, which will allow you to, adjust things a little bit. So let me know, how was that? You like it? You didn't like it? It was hard? It was easy? Beth liked it. Awesome. Tina, good. Cassie didn't care for it. Easier with repetitions. Yes. Hard or easy? Yeah. The hold was hard, but I like the short breath in. Okay. Yeah. Again, I would always encourage you to practice even the ones you didn't like a couple more times, because as you do it on your own, you're going to find the rhythm and the thing that works best for you. Yeah, it was harder because the counts were different. Yeah, absolutely. Close that out. Any other questions or concerns or feedback before I share my screen and we move to the next breath that's going to be completely different? And this one, you will have to see me at least to start, because this requires some demonstration. So give me one moment to share my screen. All right, so we are moving on to the last one, which is alternate nostril breathing. As it says on the slide, practicing this regularly may improve lung function, lower heart rate, blood pressure, stress levels. I love alternate nostril breathing before I go to bed, before a meeting or an event. And this requires a hand position. So thumb and pinky sticking out, because we're going to be closing off each side of the nose. All right. So you can just use thumb and pinky like this. I also like to put my peace fingers, as we call them in yoga, peace fingers right in the center of the forehead, kind of rest there and alternate back and forth. So find what works for you. You can rest, and I'll turn to the side a little bit. You can rest the 2 fingers on the forehead and use the pinky and thumb, or you can tuck all 3 of those fingers in the middle in and have the finger and thumb here. Typically I am here, but for the sake of you being able to see me, I'm going to tuck my fingers in. So we're going to place the thumb of the right hand over the right nostril. When you're closing off either side, be mindful to close off really at the very bottom, because if you close off fully from the side, it tends to get sticky and stuck and it'll make breathing harder. So close off that right nostril right at the bottom. And then we're going to breathe in through the left nostril. We're just going to practice a couple of times and then I'll walk us through a full cadence. So we'll breathe in through the left. Now close off the left nostril at the bottom and breathe out through the right. Now breathe in through the right. Close off the right with the thumb and breathe out through the left. So that's kind of the cadence that we're going to be going back and forth doing. You'll probably end up needing a tissue when you're done, or at least I always do. So we'll start by taking just a regular breath. And again, hop in whenever it makes sense for you. I'm using the right hand today just for ease of instruction, but you can use either hand once you get the hang of it. So that last breath, and then we're going to close off the right nostril with the right thumb. Breathe in through the left. Close off the left with the pinky. Breathe out through the right. Breathe in through the right. Close off the right. Breathe out through the left. Breathe in through the left. Close off the left. Breathe out through the right. Breathe in through the right. Close off the right. Breathe out through the left. Breathe in through the left. Close off the left. Breathe out through the right. Breathe in through the right. Close off the right. Breathe out through the left. Breathe in through the left. Close off the left. Breathe out through the right. Breathe in through the right. Close off the right. Breathe out through the left. One more round. Breathe in through the left. Close off the left. Breathe out through the right. Breathe in through the right. Close off the right. And breathe out through the left. And release and relax. Come back to your normal breath. I'm going to stop sharing one last time here if I can find my cursor. Awesome. Thoughts? What do you think? Very different. Really intentionally altering our breathing. If you remember again from the beginning of the workshop, I said right nostril activates the fight or flight, left nostril activates the rest and relax. We're balancing those things. The very balancing breath technique. Again, I love doing this before I go to bed. Yeah, it really does let you know which nostrils are clogged. 100% agree with you there, because sometimes I think I'm breathing great through my nose and I do that breath and one whole side's clogged. So we get lots. Hang on, let me open this up. Yeah, I agree. This type of technique definitely makes you more how congested you are. Yep. Nasal passage blockage. The nose is very much like other parts of our body in that you can train yourself to be a better nose breather. It does take time, and I will, if you're a reader or even an audiobook person, this book, Breath, James Nestor, again, I put the title and the author in your additional resources handout, so you don't have to write this down. You've got it already. Fascinating book. Love this book. Lots of really great research and current scientific research as well as past history of the art of breathing. So super fascinating read. Oh, yep, surgery on your nasal passage blockage. So very good luck with that. Hopefully, if you practice lots of breathing techniques before then, that'll help. And any other feedback, questions? I don't see, let me switch to the other. I don't see anybody unmuting. No. So what we're going to do now is we're going to finish up the practice with a guided meditation during which you can practice. I would say for the guided meditation, maybe practice belly breath. If you just want to do the guided meditation, just practice just deep breathing, but not necessarily worrying about the belly or the lungs or a count, that's fine too. Find what works well for you. As I walk you through the guided meditation, follow the sound of my voice. Again, any distractions or interruptions, just try to let them come and go, including your own thoughts. I am going to end the workshop when I'm done with the meditation. So if there are any just general questions or general comments, now would be the time to ask them. You're welcome to email me or call me. My phone number's in pretty much on everything coming out of this workshop. And I'll be happy to talk to you one-on-one. But I usually like to end the workshop right after the meditation so you guys can be completely relaxed. Yeah, it takes a little more coordination on the alternate nostril breathing, yeah, until you get the cadence. And you're welcome, Beth. So find a comfortable position to go through the guided meditation. If you're seated, I would encourage you to scoot yourself all the way back to the seat back so you can relax your back up against the seat. If your feet don't touch the floor, maybe you prop them up on a desk drawer or pile some books on the floor, or maybe you sit crisscross applesauce in your chair if that's available to you. You can lie on your back if that's available to you with legs out long. You can also lie on your back, bend your feet on the floor, bring your knees out to about shoulder distance apart or a little wider, and then bring the knees in to touch. That'll allow the legs to relax, but take some pressure off of the low back. Again, you're welcome to stand if you're a yoga practitioner and you want to stand in mountain pose, find what works for you. I'll invite you to close your eyes or take a soft gaze. If eyes open is the most comfortable position for you, that is absolutely fine. So get yourself settled. We're just going to turn our attention inward and take 3 to 5 breaths using whatever technique made the most sense to you today. You're always welcome to just deep breathe. And relax your attention from the breath. Gently turn your attention to your scalp and allow the scalp to release and relax. Gently allow the attention to drift down to the ears and the area around the ears. And feel that space. Let go. Move the attention to the forehead. Allowing the forehead to rest easy. And then allow the temples to relax. Area around the eyes soften, releases. Cheeks too heavy. Feels right for you. Maybe you part the lips just slightly, loosening the jaw, unclenching the teeth. If you're lying on your back, allow the root of the tongue to fall down the back of the throat. And if you're seated, allow that tongue to just rest heavy at the bottom of the mouth. The whole head relaxes and lets go. The neck and the shoulders soften, release. Upper arms and the elbows, the lower arms and the wrists, palms of the hands, backs of the hands and fingers grow heavy and weighted. Back, chest, back in the waist, low back in the belly. Sense of relaxation and release. Pelvis, hips, bottom, heavy. Floor, chair. Upper legs, knees, the lower legs and the ankles, heels, tops of the feet, soles of the feet, toes. Let go. Whole body. The whole body softens, relaxes, grows calmer with each gentle exhale. It's to come and go like clouds across a blue sky. Coming back to the anchor of the breath anytime you find yourself becoming too distracted. From the breath. And I'll invite you to take just a moment to set an intention for the rest of your day, taking any sense of calm or peace along with you. to practice a moment of gratitude, giving thanks for whatever speaks to you right at this moment. Wiggle fingers and toes, bringing soft movement back into the body. Take one last deep breath, inhaling as deeply as feels comfortable for you. Maybe a brief hold, and then a nice long exhale. And whenever you're ready, you can begin to bat those eyelashes open, bringing your attention back into the room. And then slowly, calmly, and peacefully make your way into the rest of your afternoon. It was lovely to spend time with you. Enjoy the rest of your day. Thank you all so much.